Hello, let's look at the lab test that we can do in depression. And this will be a very short video, and why? If you answer this question, you will know why. Is it possible to diagnose depression with a lab test? No. So, end of story, end of this presentation. No. So, it's not possible to diagnose depression with a lab test, but we will do a lab test anyway. And why? We need to do a general lab, we call it. A general lab excluding other diseases. For example, we do a complete count to exclude, I don't know, an anemia or any type of hematological disease that is causing this different brain activities that will make you depressed. We don't know. So there exist many diseases that are related to your body that can cause depression. It does not have to be one chemical or two chemicals. It's a group of things that are happening in your body that can lead you to a depression. And therefore we will make a complete blood count. We'll look at the electrolyte because it has been shown that, for example, if you have a low sodium amount, then you can feel, I don't know, headaches, you will feel brain activities that are strange, you are very dizzy and so on. So electrolytes, your blood components, all affect your mood, all affect your well-being, and therefore it's good to exclude other diseases before you just say that, no, this is a depressed person and we don't need to check anything because I'm the doctor told you that we cannot diagnose depression with a lab test. We will do it anyway. We will look at the status of the patient, check the urine, if something is there. Maybe it's an infection that is causing you these different brain activities, because infections can cause a strange way of thinking. You will feel very dizzy and so on. You will be infected. You can get a sepsis. These are seemingly unrelated to depression, but actually they all build up. And I would say thyroid stimulating hormone, for example, hypothyroidism or hyperthyroidism, these are hormonal changes. And when we are dealing with hormones, we know that emotions can be affected in one way or another. Hypothyroidism can lead to agitated, aggressive behavior that usually is not there in normal people. So please check the thyroid hormones, check the rapid plasma reagin. Why? Because it has been shown, for example, that syphilis can cause depression, can cause psychosis, can cause mania. So you see, it's seemingly unrelated. Things can cause depression. So rapid plasma reagin, you can rule out syphilis, because syphilis usually attacks then in the end stage your brain and your nervous system. Human chorionic gonadotropin, meaning you take a test showing if you're pregnant or not. Why is this important? There exists peripartum depression, for example, or it's important that you are treated while you will get the child soon. So that means you need to be treated, otherwise maybe you will harm your child. So these are the things that are general, not really related to depression, but we'll do it anyway. Urine toxicology, almost the same thing as urinalysis, but we will check now the substance abuse, cocaine, or do you take any type of drugs? Actually, do you take drugs? Because drugs, as we know, all can lead to different psychological problems like depression. Vitamin B12, we check your vitamin levels, your folate levels, because this has been also related to some neurological disease, for example, depression. So I would say that was it. This was a very short presentation, but I wanted to highlight that it's not possible to diagnose depression with a lab test, not possible, but we'll do general lab tests like complete blood count, like electrolytes, like urinalysis, like thyroid stimulating hormone, rapid plasma reagin, remember syphilis, human chorionic gonadotropin, check out the pregnancy level, urine toxicology, do this patient take cocaine or not, vitamin B12 and folate level, and that's it. I thank you very much, and of course there can exist many more tests that you can do generally, but I would say these ones will be enough. If you think that you need some other tests, then do that also. Okay, thank you very much for listening and have a nice day.